wisdom tooth or third molar, its removal and its complication. For most of us, our third molar or the wisdom tooth never comes out into the oral cavity in the proper form, leading a requirement for us to remove the teeth. So in this particular video, we are looking at some of the complications which can happen following a wisdom tooth removal. Hello all, this is Dr. Arun from Dentistry, running a dental centers at Chennai Rajanamalipuram since the year 2001. If you have not subscribed to our channel, please do subscribe to our channel. We've got a whole bunch of videos coming out on dental health and awareness. Now, when it comes to wisdom tooth or third molar, since it's the last tooth to erupt into the oral cavity, if there is not sufficient space in the jaw for the tooth to come out normally, it usually gets stuck. Alternatively, sometimes there is just enough space for it to come out, it doesn't come out in the right angle. So, when we plan for a removal, we plan for a removal because when it erupts, the tooth can give you pain. 2, the surrounding gum on that particular tooth can get inflamed and it can hurt you. 3, it can cause a foot trap between the wisdom tooth and the tooth in front, causing a decay either for the wisdom tooth or the tooth in front, leading for a requirement for a tooth removal. These are the usual reason where we plan to remove a wisdom tooth. So the complication of a wisdom tooth removal will basically depend on how much a surgical requirement is there for the tooth removal. If the tooth is fully erupted into the oral cavity and and its decay, the usual complications are typical of any tooth removal. What can be some dietary restrictions for the first few days, antibiotics and painkillers to be taken. The complications being some mild pain and swelling on the area of tooth removal and the adjacent jaw area, some difficulty in opening mouth, if you don't take care of the clot well, some bleeding episodes can happen. These are the usual complications which can happen after any tooth removal and also a wisdom tooth removal. But when it's a little surgical removal, what we need to understand is for the surgical removal, some amount of our bone that is preventing the tooth from coming out will be removed for the tooth to be extracted. So when that happens, usually the swelling and difficulty in opening mouth is little far more, which can last up to a few days time, sometimes even up to 5 to 7 days time following the tooth removal. This is typically because of the inflammatory process that is happening in the jawbone surrounding the tooth removal area. And because of the inflammatory process that happens there, so this amount of pain and swelling can be there for a significantly larger amount of time. Of course, it's very important to take the tablets, take all medications, antibiotics as well as the anti-inflammatory, and then do some mouth rinses and ensure that we keep that area very clean. Sometimes a medium to long-term complication that happens specifically after the lower wisdom tooth removal is something called the mandibular nerve involvement or the nerve involvement. So when the wisdom tooth, usually we have the nerve called the mandibular nerve, which is a sensory nerve which runs in the lower jaw. So that nerve, sometimes because the wisdom tooth is a last tooth and it comes near the angle of our jaw, from the angle it erupts forward. Sometimes the position of the nerve and the position of the tooth root can be in very close proximity to each other. So when they are very close proximity to each other, a wisdom tooth removal can lead to a nerve involvement. So what do I mean by that? So even though the surgery is not in the nerve area, the surgery is much above the position next to where the wisdom tooth actually is, but the manipulation of the tooth can lead to an inflammatory process on the mandibular nerve, especially when the tooth root and the nerve are in extreme close proximity to each other or on top of each other. So this is a this can happen only at a very small percentage of cases. So when it happens, typically it leads to the area that is supplied by the mandibular nerve, which is typically the lower jaw, the lower lip to one side. From here to here, this area can either feel a numbness can be there, or it can be like an altered sensation can be there in that area of supply of the nerve. So this is typically because of the nerve involvement, because of the inflammatory process that has happened. So usually we check the X-ray, if required take a CT scan to see what is the amount of chances that it can be a nerve involvement. Take all possible precautions that is required to prevent a nerve involvement there. So if it happens, usually it's a temporary phenomenon. The reason I call it a temporary phenomenon is because the surgery is not in that nerve area. Once the inflammation settles down, usually that we will start getting back the sensation normally, but it takes anywhere from 3 weeks to up to 6 months time for the sensation to become normal. So before you get your wisdom tooth, take an X-ray if required, take a CT scan, discuss with your doctor to see what is the chances of this nerve involvement that is going to be there, and then take a very calculated call based on the risk and the benefit of tooth removal, and then go ahead with it. If there are any questions, please do ask in the comment section below. Until next time, this is Dr. Arun from Pearls Dentistry. Bye bye and thank you.